Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. This is Monday Health Minutes with Valley Health. Healthcare disparities in minorities is a very common problem in healthcare. So we're talking with Dr. Leonard White today about the issue and about what help is available out there. What are some of the barriers that minorities face in getting the healthcare that they need?
One of the biggest barriers is the understanding of the social determinants of health. Social determinants of health is the concept of where someone lives, where they're born, where they worship, where they receive health care. And if those social determinants of health aren't understood, then it would serve as a huge barrier for access to health care.
So break that down for us. Where someone lives, if they live far away, it's hard for them to get to health care. If they're not aware of the help that's out there, you know, it's hard to make an appointment. What kind of help is there out there? I know Valley Health works so hard to try to address some of these disparities and get to people and get the help that they need.
Sure. Valley Health has taken many strides to minimize those determinants. One of the things that we do is we have something called telehealth, where instead of being able to come into the clinic, individuals can have access to health care just via the phone. We also open access to the healthcare records so individuals can kind of better understand their treatment and be more proactive, if you will, as far as the healthcare is concerned.
There's nothing easier than seeing your doctor on your own couch with the telehealth visit, so that's super helpful.
Absolutely.
You mentioned cultural beliefs and where they go to church. How does that play into creating a health disparity?
Well, when it comes to, again, the social determinants of health, those factors play in the whole overview of an individual as a whole. So when you think about someone, where they're born, where they live, where they worship, those things can be limited due to their social, economic, and ethnic backgrounds. For example, individuals who are African American tend to have lower income jobs. They tend to work in locations that are factory workers and things along those lines. And when you take those things into consideration, those things play a major impact on health.
Sure. If you have a lower paying job, then money is always a factor, whether you have insurance or not to cover your health care needs. But those things can be addressed also.
Absolutely. One of the things that we have to do, though, is be aware that those social determinants of health exist. And so policymakers and healthcare providers alone have to make sure that they're aware of those things. And if you don't address them, then you overlook the idea of the stress that can cause hypertension, the lack of access to various types of food or better types of food, which leads to diabetes and obesity. So healthcare providers and policymakers both have to be more in tune with these concepts in order to better help our patients.
But should patients try to advocate for themselves and just tell their doctor, look, I'm having a hard time getting here. I'm having a hard time paying for the visit. Is there any assistance out there?
Absolutely. There are a lot of community involvements that take care of things like that. When you look at, have advocated for the education of individuals, access of individuals, the Marshall Minority Institute of Health is one, Ebenezer Medical Outreach is another, and Valley Health has done several things. They've started scholarship programs. One of the things that we need to focus on is the education of not only the patients, but those who provide the patients with care. And the scholarship program is geared towards helping underrepresented minorities have access to the educational side of things. It's been shown that when people of color are treated by people that look like them, they tend to be more receptive.
Sure.
They tend to be more likely to listen to what that physician or healthcare provider is giving them, and they also tend to be more compliant with their care.
Well, it's easy to talk with somebody that you feel that instant connection with.
Absolutely.
And connect in that way. And when economics and other things come into play, there's sliding scales out there and all kinds of different help available for people to make things more affordable as far as medicine goes and appointment goes. So, Dr. White, thank you so much for being here. It's a tough subject, but it's something we need to address, like you said, on all aspects, patient side and doctor side, to try to get everyone the help that they need. We appreciate your insight.
Thank you.
Thank you. Thanks for being here for Monday Health Minutes.